As you all join in, welcome to our live session. I, Ritika Bose, on behalf of Redcliffe Labs, extend a warm and hearty welcome on this special occasion of International Men's Day. To all the audience who's joined our session today, a very hearty welcome. Please stay tuned with us. आज हम करेंगे कुछ बातें about men, their health, about their feelings, their thoughts with Dr. Varun. And also, आपसे जानेंगे कि how do you feel and how excited are you about International Men's Day? So yes, to all the men who joined us, wishing you a very happy International Men's Day. And how many of y'all were actually excited? Yes, 19th November is International Men's Day and we should plan something special for ourselves, or you were eagerly waiting about this, for this day. Can you please tell me in the chat box? How many of you actually knew that today is International Men's Day? So, कौन-कौन aware थे? डालिए chat box में और हमें बताइए. तब तक हम join करते हैं डॉक्टर वरुण को हमारे सेशन में और उनसे जानेंगे as a man what are his thoughts. तो कल एक बहुत मजेदार चीज हुई. I have a colleague here. I went to him and I said कि सर कल International Men's Day है, so आपके साथ हम कुछ बातचीत करना चाहते हैं. Then मैंने उनसे पूछा कि so the moment I said कि International Men's Day है, क्या कल International Men's Day है? I said yes. So he's like, you know, Ritika, what's the funniest part? कि कल Men's Day और मुझे पता भी नहीं था. The best part is men don't care at times. So that was a very like for me it's tough, but when it comes to Women's Day, हम लोग इतना बहुत दिन पहले से हम बहुत excited होते हैं, बहुत ही happy रहते हैं, बहुत ज़्यादा ही हम planning start कर देते हैं. But for men, they are okay with everything that's happening with them. They are like, okay, हाँ हो रहा है तो हो रहा है, नहीं हो रहा है तो भी वो उनके लिए चलता है. But वो सब चीजों के बीच में हमने ये सोच लिया, हमने ये मान लिया कि men are not sensitive, men are not emotional. तो फिर मैंने उनको ये भी पूछा कि is it that men are less emotional, men they do not care? तो he asked me back the same question कि आपको सच में लगता है कि ऐसा हो सकता है? लाइक ये तो आप बताओगे. तो फिर उन्होंने फिर से बोला कि उसे हम दिखाते नहीं है, हम शो नहीं करते होंगे, बट वी हैव आवर इमोशंस, वी केयर बट वी डोंट शो, वी डोंट एक्सप्रेस those little things, those little thoughts, but हम बस believe करते हैं in action, we keep doing. And I could actually relate because I've seen my father, I've seen my brother being, worried about his career, then when he got married, about his wife, his children, but then he never shows those things. So yes, to all those men who work, who strive, and who are continuously working to make a difference in the life of their family members, others, hats off to them, and a very happy International Men's Day to all of you who are working relentless to make a difference in the lives of your near and dear ones. And इस बीच में कभी-कभी आप अपना ख्याल रखना आप भूल जाते हो, तो आप किस तरह से अपने आप का ख्याल रखें, किस तरह से आप अपने आप पे हेल्थ पे फोकस करें, वो जानेंगे आज हम अपने डॉक्टर से. So just waiting for him to join in. Dr. Varun has joined in. Let me take the pleasure of introducing him. Dr. Varun. He is MBBS MD consultant pathologist at NRL Redcliffe Labs, Noida. Thank you so much, doctor, for taking your time out and joining us.
Thank you, Ritika, and welcome everybody, and wishing everyone a great International Men's Day.
So, doctor, when you say International Men's Day, like before I came and I told you that it was tomorrow's International Men's Day and we need to do something special for our audience. So, how excited were you about this day, or did you even know that yes, 19th November is International Men's Day and कुछ बातचीत होनी चाहिए, कुछ special होना चाहिए? I am a man and something special should be done for me. Did you have this kind of a feeling?
Okay, so first of all, yeah, I had no idea that there was something called as International Men's Day, which gets celebrated. But thanks to you, now I do know, and we all celebrate. We all need, there's enough gloom all around us. We all need a little bit of happiness, a little little things to celebrate, that brings us all joy, and why not?
तो like women में हमेशा ये urge होता है कि they want to be felt special, they want to feel special, they want to be pampered, they want to get all the surprises from their near and dear ones. Do men also have that urge कि नहीं, like somebody should make me feel special, somebody should make me feel that I am important? Yeah, that that slight attention, that pampering. क्या men also want that?
Of course, who said man doesn't want that? Everybody wants that. And like I said, you just need a little things to be, more happy or happier than you currently are. I mean, like, yeah, somebody gives you attention, somebody gives you a little bit to ponder on, and you feel great about it. Of course, yes.
तो कहावत में है कि मर्द को दर्द नहीं होता. हाँ. How true is that, and what is your opinion on that?
Okay, so if you're talking about the movie, it was a pretty bad movie. I will not recommend anybody to go and watch these kind of movies. Uh, if you're talking about a statement, "Mard ko dard nahi hota," I think it was made in a time where things were pretty aggressive. The country was growing. Things needed a head start. Things needed people with more aggressive outcome to go and do things. So I think it was a okay line in that time period. Is it okay now? Is it relevant now? I don't think so. That this statement per se holds any relevance anymore. Okay, men and women are, you know, we are heading towards a good gender equal kind of state where, everybody has equal opportunities. So why, believe on such statements and create an inherent bias in people's mind? It, in my opinion, per se, for entertainment value, for watching movies, keep your mind at home, go watch a movie with such kind of things and come back and just forget it. That is all that is left as a relevance to this particular statement.
So, as a man, do you feel that you have extra burden or extra pressure होता है आपके कंधों पे कि to make a difference in the lives of your family members and to keep everybody happy? Do you think that the extra people go an extra mile to expect something from a man? Well, society as a whole expects a little extra from a man.
So, Rutika, what I'll say is we are still in a generation jinka upbringing has been like this, right? You have a family, there's a head of house, which is usually your father or grandfather there. And we are, brought up in a way that, the boys in the family, they are made to think you have to do great things. I mean, everybody depends on you. If you're not doing it, it will not get done. So, I mean, that even from the start, even from childhood, such kind of expectations have been put on us that men feel that way. Okay. Uh, in the current scenario, do I feel in the same way? Not anymore. I don't feel that I need to be more hardworking, or I need to do something extra to make things happen. Your partner, your life partner, your spouse, they have their own hopes and aspirations. You have your own hopes and aspirations. Okay, so it is all about finding a middle ground and working towards a common goal with equal partnership, so that nobody feels an extra burden on themselves, right? You don't feel that you have to do extra to be somewhere in your life. Your partner doesn't do have to feel that way as well. I mean, of at the end of the day, you are in a partnership, and you want equal things or good things in your life, and it'll come. Believe me, it'll come when you have that sense of partnership and when you accommodate each other in your life.
So, doctor, uh, when we talk about men, do you think they are as careful or as concerned about their health as as a woman is?
Oh, I would say men are more concerned about their health than women are. You have seen, I mean, like, when you go back to your family, you see your mother, you see your sister. They are the ones. I mean, they'll feel more for your pain than their own pain, right? If your mother has something, she's not going to tell you till the time it is out of control. So, um, what do I say? It's a very tricky question. But yes, uh, because we as of now till this time, it is, I mean, it is the men who go out of the house and work things. So we have, I mean, like, as a man, I have access to certain things which my mother or my sister at home, or on that matter in general, females who are at home, women at home, may not have. I guess we as men have, better access to diagnostics or to the hospitals where we can walk freely and get things done, whereas a woman has to think about it before getting it done. Um, Kind of privileged that ways, but it has to change. It has to change.
True, true. So, since we're talking about men's day and men's health today, so what do you think? What are some of the common health concerns or the risks that men face as they age?
Okay, so I mean, the general concerns are the same for the whole populace. But even if we talk about men, the first and foremost would be cardiovascular health. I mean, like, your related to vessels and heart disease like hypertension and even heart failures, and they are at an increasing rate. You would have seen the news over the last 2 years where young men, in their 40s, 30s, and 40s, working out in the gym, just falling down and getting a heart attack and passing off. So there is an increasing cardiovascular risk among men. Yes. Then comes, of course, diabetes, obesity, and diabetes are a forerunner here. There are certain cancers, of course, it affects everybody, but men are especially prone to prostate and testicular cancers. Other than that, lung cancers have a very high, risk in men. Then, mental health, depression has a alarming rising trend among men, especially in the whole world, not only in India, in the whole world. And then sexual problems which can arise due to these, uh, you know, mm, these conditions. So you can get erectile dysfunctions and whatnot, just because you have certain risk factors.
So, what are, as you mentioned, cardiovascular risks? What are some of the cardiovascular risk signs that can be identified by men and they can take preventive measures to stay safe and healthy?
Okay. So I would say first and foremost is okay. So things like shortness of breath या सांस फूलना, जैसे हम in common language की सांस फूलने लग गई जी. पहले तो मैं 4 फ्लोर तक चढ़ जाता था, अब तो मैं एक फ्लोर पे चढ़ता हूँ, मेरी सांस फूलने लग गई है. ठीक है. This is an this is a sign that your cardiovascular health is not good, because and you have stamina. Earlier, you had stamina to walk 4 flights of stairs. Now you feel tired even after going one. So definitely something is going wrong there. So shortness of breath, छोटा छोटा काम करने पे, या sometimes people get shortness of breath even at rest. अरे कुछ नहीं किया जी, बस बैठे थे, उठे, and I feel out of breath. So these are the signs, risk, red flags actually for your cardiovascular health. Other than that, people who smoke, usually the people who smoke, they get bluish discoloration, या कहते हैं ना हाथ की उंगलियों के टिप्स नीले पड़ गए, पैर के टिप्स नीले पड़ गए, झंझनाहट हो रही है पैर में. So these are the things that smoking is doing. It is affecting your blood vessels और वो properly ऑक्सीजन नहीं पहुंचा पा रहा आपके हाथ पैर में, एक्सट्रीमिटीज, बेसिकली एक्सट्रीमिटीज तक. तो वहां पे ऑक्सीजन की कमी हो रही है. सो दिस इज अगेन रिस्क और अ रेड फ्लैग that you have a bad cardiovascular health. Other than that, एंजाइटी अटैक्स में जैसे होता नहीं है, पीपल से कि अरे मेरी धड़कन बहुत तेज चल रही है, बहुत ज्यादा पसीना आ रहा है, चक्कर आ रहे हैं, बेहोशी लग रही है. These are also some signs which are there to look out for that. Okay, you are having a problem related to your heart, relating to your cardiovascular system.
So that's actually something that men should be very careful of, and they should take timely measures so that they can prevent it.
Yes, of course. And these are the things which come early, so that अगर पहले से पता लग जाता है, then you can take measures, get health checkups done, get an intervention very early on, so that ये चीजें प्रोग्रेस ही ना हो, और या अगर मान लो प्रोग्रेस हुई भी तो बहुत डिले होके प्रोग्रेस हो, and will not pose a very great or a big health hazard as compared to when you don't pay attention to it.
True, true, very true, very true. So हम देखते हैं अक्सर लोग ये घर में बोला जाता है कि ज्यादा डैड को या किसी को ना आप ज्यादा चिल्लाओ मत, ज्यादा प्रेशर मत दो, ये मत दो, डैड का बीपी बढ़ जाएगा. So how likely is it true that कि मतलब men are at a higher risk of being hypertensive and sudden like strokes, or so their blood pressure shoots up suddenly? Is it so true?
Yeah. So see, ये कोई अब जैसे हम बात करते हैं ओबेसिटी की, हाइपरटेंशन की, ये सब एक दूसरे से रिलेटेड ही है. एंड ये सारी डिजीजेस ना, दे डोंट हैव वन कॉज. ओके, मतलब ये सारी डिजीज बहुत ही मल्टी फैक्टोरियल होती हैं. आपकी लाइफस्टाइल पे बहुत कुछ डिपेंड करता है, आपके जेनेटिक्स पे बहुत कुछ डिपेंड करता है, आपके इन्वायरमेंट पे बहुत कुछ डिपेंड करता है. ठीक है, तो बहुत सारे रोल्स, बहुत सारी चीजें हैं जो इनको अफेक्ट करती हैं. तो जेनेटिक्स, यस, देयर इज जेनेटिक प्रीडिस्पोजिशन कि अगर आपके डैड को है, आपके भाई को है, तो you are at a higher risk, yes, to develop hypertension or even diabetes. It runs in families, and if your if your parents, if your siblings have diabetes, you are definitely at a higher risk to get diabetes. But the risk, let's just say that for hypertension is much more. I mean, last week I was reading a study which quoted, a prevalence of around like 50%, 51% of men जिनके siblings या जिनकी family में hypertension है will eventually get hypertension, and that huge number. Diabetes के लिए actually men and women is kind of same, but yeah, men maybe like that study just said that men will have a incidence of chance of getting it would be like 10.8%, while women will have 10.2%. So not much difference there. But yes, for hypertension they had a staggering number put on it. Other than that, let's just say, of course, if men have prostate and testicular cancers, so I mean, like they have the organs, so we have the organs, so we are prone to develop prostate and testicular cancer. Even for that matter, male breast cancer is on the rise.
Yeah, that was something when like October was breast cancer awareness month. So I was reading about it when I heard that men are also at a risk of getting breast cancer.
Yeah, men are definitely at risk of getting breast cancer, especially if it runs in families. Okay, of course, women are at a much higher risk, but yes, men can also get breast cancer. And like you have the awareness month where it goes around that the self breast examination for women. It has been promoted to a very large extent. No, everybody says that you can just examine your breast by yourself at home. And if you have a lump, you can consult a surgeon. I would say the same thing applies to men. if you can examine your, breast or chest, and if you feel something is wrong, if you feel a lump, it is always wise to consult a surgeon. Why take a chance? Why not just consult it and, get at least mental relief?
True. Very, very true. So now we've talked about, since you've been mentioning about prostate cancer, testicular cancer, and breast cancer now. So when because we always talk about prostate cancer being quite prevalent among men. So what are the screening tests to be done for that, and how frequently should men get themselves tested for it?
Okay. So there are two very popular screening tests. One is called as digital rectal examination. It's a kind of physical examination where, manually the doctor will examine the prostate. Okay. So if the prostate is hard or enlarged, that can be made out while examining or while probing the prostate. Other other two non-invasive ones are ultrasound. Of course, you can get an ultrasound done, but that always comes secondary to no digital examination and serum prostate specific antigen assay. Okay, so that is always available with all the leading labs. We have with us as well. Now, coming to the screening value of these tests, so there are no such guidelines per se as of now to say that when to start, examining your PSA levels for that matter, or get a, prostate examination done. Uh, in US, there are that American Cancer Society has general guidelines saying that. PSA should be done in people more than 50 years. Male more than 50 years can get their PSAs done. If you have a family history of prostate cancer, then maybe at the age of 45 itself, you can get a first screening of serum PSA done. Uh, uh, US data is there, which says that people with black ethnicity have a higher chance of getting prostate cancer. So even if they don't have a family history, they can start the screening at the age of 45. Now, India, we don't have any such set guidelines for these screening tests. Okay, so what people recommend, whatever the other doctors recommend, or what makes sense is if you have symptoms or what we call as lower urinary tract symptoms like frequent urination or very you get that urgency to urinate, you can't hold your urine, or you get a repeated feeling of incomplete voiding, that okay you just went but you feel that कि पूरी तरीके से void नहीं हुआ urine, कुछ रह गया, or you feel that that there is incomplete voiding. So people, if you get these kind of symptoms at the age of around 45 to 50 years, it is worth doing a screening test for serum PSA levels. If your PSA levels are higher, you can go for digital examination and ultrasound. But then, of course, you will be in good hands. You will be with the urologist or the surgeon, so you will get good guidance per se.
So even you mentioned about testicular cancer. Now, what are the signs and symptoms of testicular cancer?
Okay, so testicular cancer usually are asymptomatic. Most of the times, when they get detected, it is very late and they have grown to a large extent. Uh, the initial sign and symptoms of usually for testicular cancers are that there is, what do I say, kind of um, um, lump or a swelling in the testes. Usually they are painless swelling. And other than that, there's certain non-specific things like heaviness in the scrotal area, or a dull kind of ache which one feels over a period of time, that okay it's not going, it's still there, heaviness, dull kind of ache. So these are the few things to look out for testicular cancer. In fact, there is like breast cancer, there is Testicular Cancer Awareness Month, which is usually April of every year. Even this year, April 2024 was Testicular Cancer Awareness Month. Like where you have like on similar guidelines where you have breast self-examination. There are a lot of uh, materials available to get to know self testicular examination, so that you can examine your testes by yourself. And if you feel there is a lump, if you feel there is pain, if you feel there is something wrong with the testicular and scrotal area, it is, do not panic. It is good that you felt it, and now you can get consultation done with your urologist, right? So no need to panic if you find something. Just consult a doctor and get the right guidance.
We have a few questions put in from my audience. So my dad has high BP. What can he do? So what are some of the measures to be taken if someone has high BP?
Okay, so one episode of high BP does not account for hypertension. Okay, there are set guidelines for diagnosis of hypertension. If he has regular high blood pressure records, please go and meet a cardiologist. You will get a better picture of what the current status is, what does the future hold, because the cardiologist will be able to tell you what complications to expect and what can be done to reduce the complications rate. In general, there's a few things which can help you lower down, the risk of any adverse conditions once you get hypertension. First and foremost is, you have to have a lower sodium in your diet. That is what everybody knows. भाई नमक खाना कम कर दो जी, नमक खाना कम कर दो जी. ओके, ठीक है, नमक कम करना पड़ता है, but you have to have regular physical activity. If you are overweight, please get your weight in control. I do not say that just go and become lean and thin. Okay, that is not practically possible for everybody. Just get your weight under control. There's a optimal BMI, or the body mass index, for everybody. For a certain height, everybody has a optimal BMI. So just get the weight under control, have regular exercise, eat a balanced diet, and follow, if you are on medication, please follow medications. And nowhere it's written that okay, after 10 days of medication, if one blood pressure reading says normal, you stop the medication altogether. Please do not do that. Continue your medications, have regular follow-ups, so that you know when the doctor says that okay, now we can reduce your dose, right? So let the doctor decide. Put your trust in the doctor. They know when to reduce the dose. They know when to stop the dose. Okay.
True. Very true. So there are a few questions, a lot of questions, and yes, there are people wishing all the out there, the men and the co-workers, about wishing each other a very happy Men's Day. So yes, so wishing all of you a very happy International Men's Day. And they have asked this question: what are some of the important health checkups to be taken in 30s? And yes, some regular health checkups that are very important for men. Please, if you could just suggest some.
We are in very fortunate times, I guess, because the health insurance sector is getting a lot of push. Everybody has a health insurance. Everybody is doing the term insurances for them. So usually they get done. They usually ask for an annual checkup. So if you ask me, what are the basic things to be done is get your CBC done, complete blood count done. Other than that, get a testing done for your liver and kidneys. So liver function tests and kidney function tests are important. If you are in 30s and you're facing weight gain, sudden weight gain, weight loss kind of things, do get your blood sugars and thyroid testing done. These are the few things. So your CBC, your liver function test, kidney function test, thyroid function, and blood sugars. If you blood sugars random would do, but if random is out of range, please go for fasting and postprandial blood sugar checkup. If they are high, you have to have you can get a baseline HbA1c, which is usually in layman's term 3 महीने वाला sugar test. Okay, तो वो भी you can get done. Get on treatment and do regular follow-ups.
That's very important because men tend to avoid all this. They are like, okay, fine, we'll get ourselves tested. So I think sometimes it's very important that the women around them, their family members, they have to coax men कि नहीं, अब सब कुछ छोड़ो, अब आप चलो, अपना ख्याल रखो. So yes, the women who are listening out there, who are a part of today's session, अगर आपके पास कुछ questions हैं ऐसे अपने हस्बैंड के लिए, अपने भाई के लिए, अपने फादर के लिए, तो प्लीज चैट बॉक्स में डालिए. हम जानना चाहेंगे या कुछ एक इंसिडेंट, मजेदार कोई इंसिडेंट हो या कोई याद हो स्पेशल आपके पार्टनर के साथ, आपके बच्चों के साथ, तो प्लीज चैट बॉक्स में डालिए, हमारे साथ शेयर कीजिए. हम जानना चाहेंगे. We have a lot of comment coming in as Happy Men's Day. They are wishing us. So again, there's a very interesting question that's come up. How men's health is important for women's health? I think that is a very important question because everybody is intertied, interrelated, and बहुत important हो जाता है सबका healthy रहना. एक इंसान घर में बीमार हो तो सबका mood off हो जाता है. तो
Like you said, बहुत जरूरी है सबका हेल्दी रहना. ओके, एक भी इंसान अगर बीमार पड़ा तो दूसरे के ऊपर इफेक्ट आता है. Like I said, no, at the times today we live in times where equal partnership is very necessary for a good balanced life. So agar if your partner is not well, you are going to stress over it. आपको कुछ ना भी हो, then you will be tense till the time that gets done. And yes, that apprehension is always there, because we are in times where information is just one Google away, right? You can hear something, you just Google it, and then the whole search engine will get flooded with information. Now we don't know what to believe, what not to believe, what is authentic, and what somebody has just scribbled down and put on internet. Okay. uh, आज के टाइम में ना बहुत important है कि don't believe any information, just any information which is out there. Please use a bit of restraint, a bit of it is critical to think about some things, right? If you are trying to know about a disease, it is good, but Wikipedia is not good enough to as good as your doctor would be. Okay, so that ways. But yes, bhai, agar, if the men in the house are healthy and hearty, everybody else in the house will be happy and you know joyous. And same goes for women as well. I If the women are happy, the men are fit and fat, very well fed.
श्योरली अगर आप खुश हो तो आप हेल्दी हो. खुश रहना बहुत ज्यादा जरूरी है. जब आप खुशी की बात करते हैं, मेंटल हेल्थ, इमोशनल हेल्थ की बात करते हैं, डू यू थिंक दैट ये जो प्रेशर होता है समटाइम्स ऑन मेन, लाइक टू मीट द सोशल एक्सपेक्टेशंस, मीट द एक्सपेक्टेशंस ऑफ देयर चिल्ड्रन, मीट द एक्सपेक्टेशंस ऑफ द लाइफ पार्टनर, दैट adds to added burden on their shoulders and leads to stress, leads to emotional turmoil within men, which they are sometimes not able to express. क्या ऐसा होता है? And what happens, like you are a man, you would be better able to say कि क्या होता है, वो जो pressure होता है उससे क्या feelings आती हैं, and how do men cope with it, and how can we as as people around them support them in this.
Okay, so again, what do I say? Maybe we are brought up in this way. Like I said earlier, that all these hopes and aspirations be put on the male child of the house, And when you grow up with so much burden on you that you feel responsible for everything which is going to happen thereafter. But uh, it is okay to feel responsible for things, but the first step which each of us should take, okay, I'm not a psychiatrist or psychologist. I'm just talking about my own experience, from my own experience, what we should, little things, what we can do. The first thing is to accept things as they are. Okay. As a person, you know your limits, right? This is the thing where I excel at. This is the thing where, I am not so good. I only know this much about this thing. So one should know their limits. Ki I can do this till here and accept it. Okay. Till the time you don't ponder on your limit and you're not, accepting that, okay, I accept that I do not know this. Till the time you don't accept things, that burden will always be there on you. Please learn to accept things. Uh, as just an example that, I'm working in your national reference lab, and there are a lot of high end testing going on. I do reports on tests, right? And but there would be some reports where I will feel shocked that, okay, fine, I don't know what this means. These are the values for this particular test. I don't know what that means. It is okay to not know. It is okay to accept that you don't know. And then the second thing is to ask for help. I always ask for help. I'll ask my fellow pathologist, okay, see, this thing has come, the values are like this. I am not sure what to make of it. I am also reading, but I am not getting any material as such to, give a diagnosis for the patient. I ask my fellow pathologist. And then maybe they have the answer. Maybe they also don't have an answer. And then you end up collaborating and finding what is best for the to give for the patient, right? So know your limits, accept things, ask for help, okay, and talk. A lot of people, as I would say, a lot of men don't feel expressive. They don't feel like talking about things, right? So I would say talking about things is a very big step. I mean, if you are able to talk about your conditions, if you're able to talk about things what are troubling you with anybody, be it your friend, be it your partner, be it your mother, be it your father. So there's somebody, you can't be alone all the time. There has to be somebody you trust. Just talk to them. Okay. That talking would bring down the stress levels like anything. Okay. You'll feel that, okay, there is somebody else, there's someone else out there to, who listens to you, who understands you, and, who will support you. Correct. So till the time you don't know your limits, you don't accept your
I think it's
shortcomings.
very important to say to ourselves, like men, women, both, that they need to say to themselves, like, it's okay. It's okay to not know. It's okay to not be able to meet expectations. It's okay to be yourself. So on this International Wednesday, I think that is one message that you've given to our audience. Be yourself. There's no need to take that extra burden. You can always seek help, and that's important.
Yes, you see, you are the best judge for yourself, right? You know your truth. You speak your truth and ask for help. That is what is needed.
There is a question out here. What is IgA nephropathy and how does it happen? Especially what are symptoms and if when does it occur? Like at what age does it occur and how can they take some precautionary measures, lifestyle changes or medicines to overcome this kind of condition? IgA nephropathy.
Okay, so IgA nephropathy. So it is a disease which affects your kidneys, as the name says. Something to do with immunoglobulin, uh, per se, immunoglobulin A. So what happens in this disease is that the immunoglobulin A gets deformed, uh, and it gets deposited in the kidneys. So the kidneys are not able to function normally, right? So the normal function of the kidneys is to filter the blood to make urine. All the waste products get filtered out, and plus it maintains the acid base balance in the body and other things, amongst other things. So what happens when the kidneys are not functional? You get you get symptoms accordingly. Correct. So now, when I read about or when I say about IgA nephropathy, of course, a nephrologist would give you a better picture of it. So, with what I currently know, IgA nephropathy is a common, I mean, in fact, the most common nephropathy which is out there right now. Though it can affect anybody, any age group, but the main peak is in young adults. So if you are in your 30s, 40s, that is where you get first diagnosed with the IgA nephropathy. Males are affected, yes, males are affected more. If you see the worldwide data, even in Asian subcontinent, if you talk about, the incidence would be similar, 1:1 if you talk about IgA nephropathy in male and female. Symptoms are usually blood and urine, an episode of blood and urine. That is what it, which gives you an alarm. Okay, something is wrong. I have a reddish urine. I have blood in my urine. That is usually the first symptoms which people get. And lifestyle modifications, like any other chronic disease, you have to have a balanced diet, physical activity, keeping your weight in control. But yes, okay, for kidney diseases, for any kidney diseases, I would not say that, usually people say that take more protein and stuff in your diet. For kidney diseases, the protein intake is usually limited because the excretion part would get affected because your kidneys are not well. So you should consult a dietitian and a nephrologist and get a diet plan for yourself, which can, depending on how well your kidneys or how much your kidneys are functional, they can make you a diet plan कि आप इतना प्रोटीन खा सकते हो, ये चीजें खा सकते हो, इतना सॉल्ट ले सकते हो, इन चीजों में ले सकते हो. Okay, so these things are to look out for because we are talking about kidneys per se. Have a thorough kidney functional essays done. Get a baseline and opinion with a nephrologist and a dietitian to consult for a renal diet.
So that's the question, and I hope you got your answer. So if there is any other question to your audience that you would like an answer to, please put it in the chat box and we would get that answered. Our doctor is here with us. We'll take up your questions. Please do put it in the chat box. So doctor, we are closing the session. We are at the verge of it. So before we end the session, what recommendations would you like to give to our audience about lifestyle modifications, about their sleep hygiene, about the healthy habits, especially men who want to maintain and balance a work-life should have a work-life balance. So what message would you like to give them and recommendations from your end for it?
Okay, so what I would say is, as a man, if you are out there working for 10 to 12 hours every day, you are going to be under a lot of stress. Believe it or not, it is going to be there every day. What little things you can incorporate in your day-to-day life as such to bring down that stress level would be, at the start of the day, uh, do an exercise. Start small, maybe 10 minutes exercise. If you don't feel like exercising nowadays, the weather is such that you can't really go out and exercise. Maybe at home, do breathing exercises, a bit of yoga and meditation just for 10-15 minutes. Don't have like an hour session or something. 10 to 15 minutes, meditate, have yoga, sit for 10 minutes, 10-15 minutes, think about your day. What are you going to do? Plan your day in ahead. You may have like 10 or 12 tasks to complete in a day. Try and see which tasks can be done together. and batch up those tasks together so that you have a clear idea. Okay, I am going today with one focused mind. I have these things to finish, reach your workplace. Best productive sessions usually require little breaks in between. So have little small breaks, 5 minutes, 10 minutes breaks between your work. Get up from your chair, move around. Okay, if you're having a coffee or tea, please don't sit and drink your coffee. Take your coffee out in the corridor, somewhere. Just take a little walk, have a chat with your colleague, have your coffee, and yes, uh, that would be enough, I guess, to get you through the day and back home safe.
It's very important that men take care of themselves. कभी कभी आप हर एक चीज को बैलेंस करने की कोशिश करते हो और आप भूल जाते हो अपना ख्याल रखना. So like there's something I read to all the men out there who are striving day and night to make a difference, to achieve their goals, striving to keep everybody happy. So to all of them, आपका खुश रहना बहुत ज्यादा जरूरी है. आप खुश रहिए पहले, फिर आप दूसरों को खुश रख सकते हैं. तो अपना ख्याल रखिए, अपने आप को खुश रखिए पहले, फिर आप दूसरों के बारे में सोचिएगा. So on this International Men's Day, we would like to give out this message to all our men. Yes, take care of everything and everybody around you, but सबसे पहले अपना ख्याल रखिए. Go get yourselves tested. Take care of your happiness. Smile. Sleep well. As doctor recommended, that yes, those small changes, waking up early, going for exercise, being cautious about your own health, knowing your body well is very, very important. And आप अगर healthy रहोगे तभी the woman in the house will feel empowered, will feel protected. So it's not just about the woman being healthy, it's about the men also in the house staying healthy and hearty so that they can pamper the woman around them and make them feel special. So that's very, very important, I think. So yes, Doctor, you had a lovely, lovely session with you. It was a pleasure that you took time out and joined us. And
My
I'm sure the audience who joined us has had been a part with us and stayed through the conversation. They've enjoyed a lot. So yes, thank you.
thank you, and thank you everybody for your patience listening. And yes, like Rutika said, अपना ख्याल रखिए, know yourself, get tested at the right time, right modifications, lead a healthy life.
Yeah, good. Thank you so much. Take care. Bye bye, dear audience. Bye bye, doctor.
Bye
Happy
bye.
International Men's Day once again.